Welcome. It's Thursday, and it's time for the Plant Based Lady podcast, baby. The podcast where, we explore the real stories and insights from the front lines of health. Yeah, that's right. Hail to the year. I'm your host, Catalina, the Plant Based Lady. I'm a registered nurse and I am also a plant based health coach. That's right. I am a registered nurse and a plant based health coach. Today, I want to share a deeply personal journey with you, a journey that spans over 2 decades in nursing and absolutely completely reshaped how I view health, healing, and the incredible power of food. When I first stepped into the world of nursing, like 20 years ago, my head was filled, man, with everything I learned in nursing school. And you know what? Let me tell you, the curriculum was crazy intense. Absolutely, right? We mastered acute care, pharmacology, disease pathology, and how to recognize and manage immediate symptoms. But looking back, there was truly a significant blind spot: nutrition. Yes, it felt like it felt like nutrition was an afterthought, like a supplementary topic rather than a foundational pillar of health, which is a problem, right? Huge problem. We touched on basic food groups or even specific dietary restrictions for conditions like diabetes. But listen, like the profound evidence-based benefits of a plant-based approach, that was ridiculously absent from our formal training. It wasn't good. It wasn't just my experience either. Like, historically, nutrition education in medical and nursing schools has just been significantly fragmented. And you know what? Very overlooked. It's awful. We were trained to treat illness, right? We were trained to treat illness and just weren't taught how to prevent or reverse illness through, you know, dietary means, right? So I became a nurse with this huge educational gap. And you look at the true reality in the hospitals, right? And facilities and home care. All of it is just so frustrating. It's so frustrating. Yes. And over the 2 decades, I witnessed firsthand the relentless, absolutely positively relentless progression of chronic illnesses. It's awful. Day in and day out, or for my case, night in and night out, whether I was working in medical ICU unit, the ambulatory care unit, whether I was a case manager in home health, visiting nurse, or even in the psychiatry setting, right? I saw patients time and again battling advanced coronary artery disease, right? Uncontrolled type 2 diabetes, obesity, and you know what? Really bad chronic pain from autoimmune disorders, just time and again. And so many times, their histories pointed absolutely positively directly to dietary habits that, were high in processed foods, saturated fats and sugars, animal foods. It's like, we're constantly patching holes in a sinking ship, right? We're experts at managing symptoms with medications and procedures, but we're not truly, honestly, addressing the underlying causes. The sheer volume of these very preventable conditions has completely underscored a fundamental flaw in our in our healthcare approach. It's totally like, whoa, right? I remember feeling pissed, realizing that a critical piece was missing from my professional knowledge, the missing nutritional knowledge that really could empower patients towards truly sustainable health. And so I'm here to say my own shift was like gradual awakening, both personally and professionally. Yes, it was like just gradually shifted. Over the years, I started researching and digging deep, really, really deep with, educating myself. And I have honestly learned so damn much. I've learned an extraordinary amount of education. And you know what? I'm seeing more and more compelling research that's emerging every single day. And over the last 20 years, the scientific community's understanding of a whole food plant-based diet has truly evolved. Yeah. Yeah, it's like just over the past 20 years. And what's been considered a niche is now recognized by leading medical organizations like, you know, the American Diabetes Association, babe, and the American Heart Association, honey, as a viable, very viable, healthy, and safe option for managing and preventing chronic diseases. Huh. This growing body of evidence was a huge revelation for me. And you know what? A whole food plant-based diet, one that's really rich in fruits and vegetables and whole grains and legumes and nuts and seeds, with very minimal processed foods, right, has been shown to reduce the risk of heart disease, lower blood pressure, right? Lower blood pressure and help maintain a healthy weight. And, for type 2 diabetes, it can lower the risk of developing it totally and completely, and can significantly improve blood sugar control. That sounds good, right? It's not just about prevention, it's about reversal too, and profound health improvement by supporting the immune system. And a whole food plant-based diet, it helps with reducing inflammation, and it helps with promoting a healthy gut, which is what we talked about last week, right? A healthy microbiome. This understanding fundamentally, hugely reshaped my perspective. Diet wasn't just about weight. Yeah, it was primarily it was a primary modality, right, with disease management and reversal. So, so with this profound knowledge and passion, I started integrating it into, how I rock and roll, right? And let me please pause for a sec and tell you, it wasn't easy. Honestly, it wasn't easy for me. I didn't know the first thing, right? So first there was my own confidence. Like most nurses, I love you so much. Like most nurses, I initially really lacked a working knowledge of how to even eat a whole food plant-based diet. Really, I was like, oh my gosh, myself, right? And trust me, there's a lot of nurses, honey. There's a lot of nurses many times that feel really hugely unsure, and they don't have a lot of confidence when they're trying to provide all their patients with detailed nutritional advice. Most of the time, the advice we offer, sadly, think about it, it comes from unreliable sources, and I definitely had to embark on my own little journey of self education, all of that to feel truly, truly confident and actually be competent myself. Yeah, it was a journey. It's been a journey. I love you. And then there were the systemic hurdles, right? Time constraints during patient visits were and still are, were and still are a huge obstacle as a nurse, right? You think about like the relentless pace of patient care that we are running with. It's always meant, right? It's always meant that dedicated time to have any in-depth nutrition counseling has been such a luxury, never mind, right? That's always just hardly ever afforded. Seriously, folks, right? And let's be honest, nurses themselves face challenges. We do. We face challenges with maintaining our own healthy eating habits, right? Honestly, nurses are no different. We're human beings. And with those nonstop 12 and 16-hour shifts without being able to even pee and having super limited access to healthy foods ourselves, it's like crazy, right? It's hard to preach what you can't practice, right? I'm hugging you. So finally, you know, think about my beautiful, amazing patients. And many of my patients just weren't interested. They just weren't interested. They were too sick, in too much pain, or you know what? This was a biggie. They thought that making dietary changes would be way too difficult or or way too expensive. And you know what? It's so clear that just trying to give advice isn't enough. Just giving advice isn't enough. For me, to help them make real sustainable change takes a huge, ginormous understanding of their motivations, right? Their barriers and the ability to provide them with long-term support. It's huge, right? So given all of this, what do I believe personally is the path forward? What is it for empowering nurses and patients in this critical area? What do I believe? The path forward demands a fundamental shift. Yes, please. We need to reimagine nursing education, right? We do. We need to think outside the box. We need to integrate true, comprehensive, whole food, plant based nutrition education throughout the nursing school curriculum experience, right? Throughout the entire thing, and not just give a blurb about adding a little more fruits and vegetables, right? When it's like, convenient. Really, we need more than just a blurb. This means we need more practical, hands-on learning, honestly, and we need to be addressing faculty expertise. And for practicing nurses, for us practicing nurses, right? Continuous professional development that's focused on real whole food plant-based eating is absolutely key. We truly need to make it a priority that nurses are provided with the knowledge. Nurses need knowledge, right? And with consistent and ongoing education, nurses could significantly be more able to provide much better nutritional advice and education and be able to walk the walk and strut the strut themselves with a huge amount of confidence. Yes, please, right? Can I get a hell yeah? And we also need to foster stronger interdisciplinary collaboration. Please. Nurses are on the front lines. We're on the front lines, right? But to be able to provide effective nutritional care, nurses need to work hand in hand. Nurses need to be able to work hand in hand with registered dietitian, nutritionists, physicians, and other specialists, right? Teamwork makes the dream work, baby. Yes, we need to not be divided. I can't tell you how many times as a nurse I've been told to stay in my lane. And when I've tried to give nutritional advice from a whole food plant-based standpoint, it's so frustrating. It really is. Stay in your own lane. Like what? Nurses are uniquely positioned to address the root causes of disease, honestly, through lifestyle interventions, including diet. We need to be able to identify the potential dietary root cause and be able to provide our fellow dietitian, our fellow doctor, and then some with the whole picture when we're referring or communicating with them, right? We need to know what we're talking about. Ultimately, it's about cultivating nurses as catalysts for health, right? Yes, yes, absolutely. We're uniquely positioned to educate patients, and by us modeling healthy eating habits ourselves, yes, we can inspire our patients. We can inspire our patients and others, the people that we love and know, to make similar choices. Yes, yes, we can be that example. This is why I developed my 12-week plant-based BASH group coaching program. Yes, it's designed to provide the practical tools, knowledge, and community support, baby, that I often wished that I had earlier in my career, both for, healthcare professionals. It's for both healthcare professionals and anyone looking to embrace a whole food, plant-based lifestyle. Do it, be it, love it, baby. It's about moving beyond just advice to truly empowering individuals to make sustainable, impactful changes for their health. Yes, sustainable and impactful. My journey over 2 decades has revealed a profound truth. Nutrition. Nutrition. I can't stress it enough. Nutrition, especially a whole food plant-based diet, is a cornerstone of health, and it's a super powerful therapeutic tool. It truly is. It can't be overstated. The educational void, which has left nurses unprepared to address the dietary roots of chronic illness, has been hugely illuminated by the escalating burden of very preventable diseases. It's mind-blowing. The urgent need for change is undeniable. It's undeniable. We need a proactive, nutrition-centered approach with nurses at the forefront. Nurses have to be at the forefront of patient education and lifestyle intervention. Yeah, this vision for the future promises that not just improved patient outcomes, but a healthier, more resilient society. A more resilient society where nutrition is recognized as a fundamental pillar of care. Absolutely, positively. Thank you. I love you so much. Thank you for joining me on this Thursday's podcast today. And if you're ready, ma'am, sir, to take control of your health, or if you're a nurse looking to deepen your understanding of plant-based nutrition, I invite you. I love you, and I invite you to explore my 12-week plant-based BASH group coaching program. Yes, please do it, be it, love it. You can find more information in the description below, or you can go to plantbasedbash.com and you can book a free, no obligation call with me, and we can connect about what you're going through. And we can connect more about what you've heard here today. So I'll see you next Thursday. Remember, your health is your greatest wealth, baby.